Every day, countless individuals around the world face the harsh reality of kidney failure, where life is dictated by the relentless cycles of dialysis and the hope for a miracle. But for those fortunate enough to receive the gift of a kidney transplant, it's more than just a medical procedure. It's a life-changing story of resilience, science, and the boundless gene. Imagine waking up one day to discover that your body is finally free from the chains of a machine, that your once fading vitality is beginning to return. The journey of a kidney transplant is one of transformation, hope, and renewal, where the merging of cutting-edge medical expertise and profound acts of giving creates a future that once seemed impossible. This is the story of how lives are saved, one kidney at a time. Today, join us to learn about the kidney transplant process and possible complications when performing a kidney transplant. A kidney transplant is a surgical procedure that places a healthy kidney from a living or deceased donor into a person whose kidneys no longer function properly. Chronic kidney disease, CKD, and end-stage renal disease, ESRD, often necessitate this procedure as a life-saving treatment. The process of undergoing a kidney transplant is multifaceted, involving a series of steps that include evaluation, finding a suitable donor, preparation for surgery, the operation itself, and post-transplant care. 1. Evaluation for kidney transplant. The first step in the kidney transplant process is a comprehensive evaluation to determine if a patient is a suitable candidate. This involves medical assessment. Patients undergo a thorough physical examination and various tests to assess their overall health. These tests often include blood work to check for anemia, electrolyte imbalances, and infections. Imaging scans such as ultrasounds or CT scans to assess kidney anatomy, and cardiac evaluations like an echocardiogram to ensure the heart can handle surgery. A study published in the Clinical Journal of the American Society of Nephrology highlights that cardiovascular disease is a leading cause of complications post-transplant, making cardiac evaluations critical. Additionally, infections such as hepatitis B, hepatitis C, and HIV are tested, as these can influence the transplant outcome. Research in transplantation reviews underscores the need to optimize the patient's health status to reduce perioperative risks and improve long-term survival rates. Psychosocial evaluation. Psychological health and a strong support system are vital for the success of a kidney transplant. Patients meet with a psychologist or social worker to assess mental health, coping mechanisms, and family or caregiver support. Anxiety, depression, or other psychiatric conditions, if left unaddressed, can hinder recovery. A review in the Journal of Nephrology and Transplantation shows that patients with robust psychosocial support and positive mental health are more likely to adhere to post-transplant care and achieve better outcomes. Social workers also evaluate practical concerns such as transportation to medical appointments, financial resources for medications, and the ability to follow a rigorous medical regimen. This evaluation ensures patients have the tools and support needed to manage post-transplant responsibilities. Eligibility criteria. Not all patients are eligible for a kidney transplant. Several factors influence eligibility. Active infections. Patients with untreated infections may need to resolve these issues before being approved for transplantation. A study in clinical transplantation found that untreated bacterial infections significantly increase the risk of post-operative complications. Recent cancer diagnoses. Patients with a history of cancer must demonstrate a period of remission. The length of time varies by cancer type, but typically ranges from 2 to 5 years, depending on the aggressiveness of the disease, according to guidelines from the American Society of Transplantation. Severe heart disease. Patients with significant cardiac issues may not tolerate the stress of surgery. Cardiovascular assessments using advanced imaging techniques or stress tests are often conducted to evaluate risk. Age and life expectancy. While there is no strict age cutoff, older patients are evaluated more rigorously for comorbidities and overall life expectancy. A report in the New England Journal of Medicine shows that kidney transplantation can still be beneficial for older adults with minimal comorbid conditions. Obesity, high body mass index, BMI, can complicate both surgery and recovery. Weight management strategies are often recommended before placing patients on the transplant list, as highlighted in a study from obesity research and clinical practice. 2. Finding a suitable donor. The next critical step is identifying a suitable donor. Donors can be classified into two categories. Living donors, often family members or close friends, can donate one of their kidneys. The advantage of living donor transplants is the ability to schedule the surgery at a convenient time, as well as better long-term outcomes. According to data from the National Kidney Foundation, living donor kidneys last an average of 15 to 20 years compared to 10 to 15 years for deceased donor kidneys. Deceased donors. When a living donor is not available, patients are placed on a waiting list managed by organizations like the United Network for Organ Sharing, UNOS, in the United States. The allocation system prioritizes patients based on factors such as blood type compatibility, tissue match, and the severity of their condition. Compatibility testing, matching donor and recipient, involves blood type matching, tissue typing, HLA matching, and cross-matching to ensure that the recipient's immune system will not reject the donated kidney. 3. Preparation for surgery. Once a suitable donor is identified, preparations for the transplant surgery begin. Pre-transplant testing. Additional tests are performed to confirm the patient's readiness for surgery. These tests include chest X-rays, electrocardiograms, and infectious disease screenings. Immunosuppressive therapy. Planning. Patients must take immunosuppressive medications to prevent their immune systems from rejecting the new kidney. A review in transplantation proceedings highlights the importance of tailoring these medications to minimize side effects while maintaining effectiveness. Surgical consent. Before surgery, patients meet with their surgical team to discuss risks, benefits, and procedural details. Consent forms are signed after addressing any questions or concerns. 4. The kidney transplant surgery. The transplant surgery itself typically lasts 3 to 5 hours and involves the following steps. Surgical procedure. The surgeon places the donor kidney in the lower abdomen and connects it to the patient's blood vessels and bladder. Interestingly, the diseased kidneys are usually left in place unless they are causing complications such as infection or high blood pressure. Anesthesia and monitoring. General anesthesia is administered and the patient is closely monitored throughout the surgery. Modern advances in surgical techniques and anesthesia have significantly improved the safety of kidney transplants. Immediate post-operative care. After surgery, patients are moved to a recovery room where vital signs are monitored and the new kidney's function is assessed. Many patients experience an immediate improvement in urine output, which is a promising sign of kidney function. 5. Post-transplant care and recovery. Recovery after a kidney transplant is a lifelong commitment. Key aspects include immunosuppressive medication. To prevent rejection, patients must take immunosuppressive drugs daily. These medications, however, come with potential side effects, such as an increased risk of infection and certain cancers. A study in The Lancet notes ongoing research into improving immunosuppressive protocols to enhance patient outcomes. Regular follow-up. Frequent checkups are required to monitor kidney function, medication levels, and overall health. Blood tests to measure creatinine and other markers are crucial during the initial months post-transplant. Lifestyle adjustments. Patients are advised to maintain a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking and excessive alcohol consumption. The American Journal of Kidney Diseases emphasizes that adherence to these guidelines improves long-term graft survival. 6. Challenges and complications. While kidney transplantation is life-saving, it is not without risks. Complications can include rejection. Acute or chronic rejection occurs when the immune system attacks the transplanted kidney. Advances in immunosuppressive therapy have reduced rejection rates significantly. Infections. Immunosuppressive medications increase susceptibility to infections. A systematic review in clinical infectious diseases highlights strategies to prevent and manage infections in transplant recipients. Recurrence of kidney disease. In some cases, the underlying kidney disease may recur in the transplanted kidney. Other complications. These can include blood clots, urinary complications, or side effects from medications. Conclusion. Kidney transplantation offers a second chance at life for patients with ESRD. Understanding the intricate process, from evaluation and donor matching to surgery and lifelong care, is crucial for making informed decisions. Advances in medical science, such as improved immunosuppressive drugs and surgical techniques, continue to enhance outcomes for transplant recipients. By following medical advice and maintaining a healthy lifestyle, patients can achieve a significantly improved quality of life after a kidney transplant. If you found this video valuable, please give it a thumbs up and subscribe to our channel for more helpful health tips. Thank you for watching. Your wellness is our priority.